My name is Taylor Abba, and welcome to my presentation on indoor air quality. So what is indoor air quality? Indoor air quality, or IAQ, refers to the air and its quality both within and around buildings and how that air impacts the health and well-being of the public. The Environmental Protection Agency, or the EPA, is in charge of the Indoor Environments Division, or the IED. The IED provides guidance and programs to help build the knowledge within communities to help them better understand and avoid indoor and outdoor poor air, health quality, or pollution, and possible impacts that result from that poor air quality and pollution. Poor indoor air quality and pollution has both immediate and long-term effects. The immediate effects occur either after single exposure or repeated exposure, and typical symptoms include headaches, dizziness, fatigue, irritation of the eyes, nose, and throat. Since these symptoms are similar to those of colds and other viral infections, it can be hard to determine if the symptoms are actually from indoor air pollution. Immediate reactions can also be influenced by age and pre-existing medical conditions. If the pollutant source can be identified, then treatment is simply eliminating one's exposure to the source, but this is not always an easy task. Now, long-term effects can be extremely debilitating and fatal. They include respiratory diseases, heart disease, and cancer. So what are some primary causes of poor air quality and pollution? So there are three main ones. The first one is the release of pollutant gases or particles into the air. The second is inadequate ventilation. Inadequate ventilation can increase pollutant levels if not enough outdoor air dilutes indoor emissions. And without this dilution, pollutants accumulate and create health and well-being concerns. In this picture that's now on the screen, you will see that natural ventilation normally includes just opening up windows. But as you can see, there are different types of ventilation, all of which are beneficial to improving air quality. And lastly, high temperatures and humidity levels can also increase concentrations of some pollutants. However, the relative importance of any single source depends on how much of pollution a pollutant emits and how hazardous those emissions are. So there are several sources of indoor air pollution, and they include fuel-burning combustion appliances such as oil, gas, kerosene, coal, and wood, tobacco products, household cleaning and maintenance products such as insulation that contains asbestos, wet or damp carpet, central heating and cooling systems, humidification devices, excess moisture, and outdoor sources such as radon, pesticides, and other outdoor air pollution. Unvented, malfunctioning, or inappropriately used products can release higher and possibly dangerous levels of indoor pollutants, and signs of poor air quality include moisture condensation on windows and walls, smelly or stuffy air, dirty heating and cooling appliances, and moldy areas. So to elaborate, I'm going to look into the 6 main sources of indoor air pollution. So the first one is radon, which is a colorless, odorless, and radioactive gas that can cause lung cancer. It is estimated to contribute to anywhere from 7,000 to 30,000 lung cancer deaths annually. Environmental tobacco smoke, or ETS, is a complex mixture of smoke that comes from over 4,000 compounds and is often referred to as secondhand smoke. Carbon monoxide is a colorless, odorless gas that interferes with the delivery of oxygen in the body that can cause a range of symptoms such as fatigue, dizziness, consciousness, and in some cases, death at higher levels. Sources include unvented kerosene and gas-based heaters and car exhaust and attached garages. Since it's a colorless and odorless gas, many homes require both a fire alarm detector and a carbon monoxide detector. Nitrogen dioxide, similar to carbon monoxide, is a colorless and odorless gas. However, nitrogen dioxide is a gas that irritates the mucous membranes in the eye, nose, and throat, causing shortness of breath at high levels and may lead to lung disease. Sources include kerosene heaters and unvented gas stoves. Asbestos is a dangerous fiber and possible particles that can cause lung cancer, mesothelioma, and irreversible lung scarring. Lead is another chemical that affects basically all systems in the body and can harm the brain, blood vessels, and kidneys. So there are 3 basic strategies to improving indoor air quality. The first is source control. Source control is usually the most effective way because it reduces or eliminates individual sources of pollution and their emissions. It is accomplished by either sealing and closing or adjusting appliances to decrease the amount of emissions. The second strategy is improved ventilation. Improved ventilation involves increasing the amount of outdoor air that enters inside. Natural air reduces indoor pollutants by increasing outdoor ventilation rate. Examples of improved ventilation are indoor bathroom and kitchen exhaust fans. And lastly, air cleaners. Air cleaners are more so designed to remove gaseous pollutants rather than particles, and their effectiveness depends on how well it cleans, filters, and collects pollutants from indoor air. So now we're going to look at clean cooking. Clean cooking has emerged as a major concern for global public health due to the high burden of disease that can be traced back to traditional ovens, heaters, and fires. Household air pollution, or HAP, causes an estimated 4 million premature deaths annually, especially among the poor, women, and children in low-income countries. HAP has been linked to low birth weight, stroke, cardiovascular disease, lung cancer, and eye disease, to simply name a few. In 2014, the World Health Organization, or WHO, released its Indoor Air Quality Guidelines, or IAQG, for household air combustion. These guidelines were implemented to address and alleviate the public health burden of household and indoor air pollution globally. The Clean Cooking Implementation Science Network is a program that was designed by the Global Alliance, the NIH, and other federal agencies to design a comprehensive knowledge platform to improve the provision, uptake, and usage of evidence-based clean cooking interventions. Influence on clean cooking include fuel pricing, capital needs, fuel supply security, gender, background knowledge, wealth, culture, and religion. And this video is going to go more into depth on clean cooking.
Cooking is a life-sustaining act, a way to nourish and to show love. But in developing countries, solid fuels like wood and coal are often used in traditional stoves for cooking. And for 3 billion people, it can cause respiratory illnesses, heart problems, and even death. Women and children are the most affected, since women do most of the cooking with their children nearby. The estimated welfare losses are $1.5 trillion each year. And many young children miss school because they're helping their mothers collect firewood for cooking. About 1/3 of wood fuels is harvested unsustainably, contributing to climate change and desertification. Greenhouse gas emissions from non-renewable wood fuels for cooking amount to a gigaton of carbon dioxide per year. If current trends continue, 2.2 billion people will not have access to modern energy cooking services by 2030, jeopardizing the achievement of Sustainable Development Goal 7 and progress across other Sustainable Development Goals. Cooking with traditional stoves and solid fuels is not a new problem, but it's one that's often overlooked. However, it cannot be overlooked any longer. Clean cooking must be a political, economic, and environmental priority, supported by policies, investments, and multi-sector partnerships. To make that kind of change, the level of commitment and the scale of investment matter. That's why the World Bank's Energy Sector Management Assistance Program is establishing a $500 million clean cooking fund. It will support and complement the high-level coalition of leaders for clean cooking under the Health and Energy Platform of Action and catalyze billions in public and private investments. The Clean Cooking Fund will co-finance investment projects in countries where large populations still cook with traditional solid fuels. And it will provide clean cooking solutions that people want and need, ensuring that they will be truly adopted. Using results-based financing, the Clean Cooking Fund will also help establish an impact bond market to monetize the health, gender, and climate impacts of projects which can attract additional funding for the clean cooking sector. It's time to scale up public and private investments to deliver clean cooking solutions in every household. For women's empowerment, happier, healthier families, a cleaner environment, and a better world.
So I hope you enjoyed that little kind of wrap-up video on clean cooking. And when I post the link to this YouTube video, I'll have all my discussion questions in the comment box below. Thank you, and I hope you enjoyed my presentation.